All right, so I'm here with Jason Sayer. He loves being on video. All right, so we are talking to Dr. Jolene here. And Dr. Jolene's going to tell us a little bit about, or maybe a lot about, the impact study and what that is and why that's something that we should consider for in Georgia.
Yeah. Well, the first thing, let me tell you that any questions that you have about this, I'm happy to answer. The Florida Dental Association Foundation is very willing to share all of the information that we put together so far. We wanted to have a protocol that was scientifically valid and reliable. We were trying to collect data so that we could have information not only on the demographics of the patients, but also the characteristics of the patients who attend a Mission of Mercy. If the patient attends a Mission of Mercy and we don't collect that information, then we are just doing a 2-day event and we're leaving. And leaving that community basically with some healthier smiles and some pain-free and infection-free patients, but we're not leaving a sustainable long-term benefit to that community. So what we wanted to do was to have an after-MOM effect. So after the Mission of Mercy was completed, we could have some type of meaningful, community-specific effect on that area that we serve. So what we did was develop the Mission of Mercy impact study. The overarching goal was to determine, is there an effect of the Mission of Mercy on hospital emergency department utilization for non-traumatic dental procedures. So usage in Florida of the hospitals for dental problems cost our state over $500 billion. No, that's wrong. Sorry, $500 million, $500 million each year. So we have data from the hospitals that tell us who goes to the hospital for dental problems in terms of their payer status, and we found that the hospitals collect on average about 10% of the dental-related hospital ED charges. So we partnered with our hospitals, our hospital foundations, when we did our first study in Jacksonville, and they were all over it. Any way that the hospitals could get those patients out of their emergency departments and to get them to sustain care in a dental home, they were all about. So they gave us lots of money. So we got sources from that we had never expected, income sources for benefactors.
They are both coming back tomorrow.
Uh-huh.
And they told me to bring their records up here so they wouldn't have to find, and I don't think that was the right thing to do, but I'm doing as I was told.
Yes, ma'am. You have your Saturday bands on?
They do.
Okay.
And then you put the number on it.
Okay. And then you're already pre-screened for what it is that you need to
Correct.
do?
They had some work today and they're going to have more tomorrow.
Okay. Their chart actually needs to be in routing.
Okay.
Because routing is where they save the chart.
Okay.
And now when you come back tomorrow, you know that you need to be here at 5 o'clock, right? And you need to come in gate 1, door 1 over there. So with that special band, you should have a pre-screen band that's gold. Do you have a gold? No? It's okay. So you'll come back through that door number 1 and they'll pick up your charts right on the other side of that white curtain. And then you'll walk on in. Okay? All right. Thank you. Oh, you're welcome. So when we have benefactors that are non-traditional sources, we ended up getting $70,000 from one of the hospital foundations, $25,000 from another hospital foundation, because they believed in what we were trying to do. So, for example, in Jacksonville, we had data that showed that a large percentage of Mission of Mercy attendees, okay, you want to wait?
Oh no, this is great.
That Mission of Mercy attendees came from certain zip codes. So by having that information, we could share that with the hospital, and we did together community outreach. So they sent information to the individuals in that zip code, and then they developed a protocol for having their screening vans go to that community, set up times where they screen dental patients, and then those patients were referred to one of the FQHCs, County Health Department, community health centers, to try to find those patients in the highest risk that were most likely to go to emergency department to be able to get them a dental home. So the other side effect of the Mission of Mercy impact study has really been that we have expanded our benefactors to those individuals that you might not think would be big benefactors of a dental event. And one of the things are the CRA credits that financial institutions can receive for providing financial information, especially to extremely low and low income individuals. And as you know, most of the individuals that attend a Mission of Mercy, they are in that category. We had about 91% of our attendees in Pensacola that were in that extremely low income category. So the lower the income, then the more credits that financial institution gets for providing services and education to those groups. So we have a lot of banks that are supporters because they can benefit. It's a win-win for everybody. But unless you collect that data about their household income and about their family, number of household members in their family, then you can't calculate what are they above or below federal poverty level. Are they in the guidelines for the income bands for the CRA credits? So there's a lot of additional benefits that you can get besides having just a Mission of Mercy after effect and having the emergency department utilization go down and patients actually receive care and find dental homes. So what other kind of things are you interested in? I could talk all day about this because it's a passion of mine and I really love it. And I'm happy to answer any questions that anyone has. The Florida Dental Association Foundation put together the protocol. Again, we hired a health policy expert. Her name is Dr. Jill Herndon. She was formerly at the University of Florida Health Policy Institute, and she's done work for HHS and for CMS, Center for Medicaid, Medicare Services, as well as the DQA standards. She's excellent. She has really taken a passion for our event, and she wants to help other individuals that want to do an impact study in their communities. But she helped us develop the protocol to go through the IRB process to get a certified, valid, reliable scientific database. And we shared that information in December 2016 with the other 28 places that do a Mission of Mercy. So our study questions, our protocols, our informed consents, English, Spanish, both of those versions, all available. Our foundation board voted to share all that information with anyone who was interested in having it. So we did send that out to all of the entities. If you still need that, we're happy to share that with you. There's no reason for you to spend $40,000 on developing what we've already done. You can spend your money on getting your IRB approval. You can spend your money on the data analysis. But what we have now is an initial manuscript that we submitted to JADA, and it has been accepted for publication. And that talks about the characteristics of the patients who attend a Mission of Mercy and their patterns of their emergency department use. We'll have a second manuscript that we'll prepare once we have all the data analyzed from the effect of the Mission of Mercy on the hospital ED utilization. Now, it's very possible that it might go up in terms of the number of individuals that went to the hospital after a Mission of Mercy because of increased awareness. We had to turn away 7,500 patients in Jacksonville. So when we had that many patients we had to turn away, they're very aware of their need. They know they have to do something. They showed up because most likely they're in pain and need help. And so what happens is I'm sure those people are going to go to the emergency room. So we may have a spike up initially. But one of the other things we partnered with local FQHC. Actually, a dental director supervises 4 different FQHC clinics. And she's found that she had a significant increase in the number of people that attended because we have a resource guide. Take a break. Yeah. I was going to make Jonathan go get me some water before we started. She can always edit it.
Let's see. Well, no, it's Facebook Live.
Oh, you're terrible.
So, what is the like as far as? Let's see. Is there water nearby?
And you shouldn't have done this at 5 o'clock after I've been here since 4 o'clock in the morning.
It's perfect. It's perfect.
Hey, all my GDA friends.
Hey.
Tell Jonathan he is a bad boy for doing this to me this late in the day.
Well, I think we have pretty much. I think the information. I think you've given us plenty. You were saying we need to get started on a particular certification.
Okay. If you go to we use an IRB that's called Integrity.
Okay.
So we send our study questions, we send our informed consent, we
Okay.
send our protocol, not
Okay.
only for the study itself, but our protocol for our volunteers, how we train our impact study volunteers. And I think you guys got some of that when you were outside on the live video. That entity then approves your study,
Okay.
and that is that extra credibility
Okay.
that you get from
And
it.
about how long does it take to set that up?
From when you submit, there's probably, you have to have a principal investigator.
Okay.
Okay, and whoever that principal investigator is has to submit the information. You have to submit your CV and your license number and a series of questions, which aren't really difficult. It might take, I'm going to say, 3 hours to
Okay.
fill everything out that you need to have filled out.
Yeah.
You don't have to do a new protocol, so all you do is attach it and send
Yeah.
it on off. Once you send it off, you usually get, the board meets about 5 times a week.
Okay.
So you can get your approval back easy in a week from when you send
Okay.
it off.
All right.
So it does not take a long time.
Could you get a water?
Okay. And if you have a thanks, Jake. So if you have the protocol, no.
Is that a phone?
So it's got somebody's initials on it.
Okay.
Yeah,
All right.
no way. No.
Yeah.
But it's a very easy process. Once you establish your initial approval, then when you do an additional site, okay, we started out, we got our approval for Jacksonville.
Uh-huh.
When we got ready to do Pensacola, you do what's called a continuing review.
Okay.
So the initial setup and approval was $1,200. The continuing review is $600.
Okay.
So
So
it is
we-
not real expensive. You can go to other IRBs that, those boards, they cost all different kinds of money. But this is one that was recommended by us, by other scientists, that
Okay.
they use because
Oh,
it's very
that's-
reasonable, and they meet very, very frequently.
So the steps would be get the information from you guys,
Mm-hmm.
and then get that certification done,
Right.
and then make sure our software and paperwork is ready, and then
That's
that's
right.
something that we could do.
That's right. It would
Okay.
be. It is not hard to implement it in your Mission of Mercy.
Okay.
Incorporating it, it's questions 8 through 18 and our 1 through 26. So we just, you just breeze right through it. You can watch the webinar, which shows an actual demonstration of the software and how we enter the information in. Patients can choose not to do it. And there's certainly no problem if they choose not to do that. We still there's no preference given to patients who do the study. There can't be.
Right.
You can't do that. The one step that's a little bit different, that maybe from what you're doing, thank you very much, than what you're already doing, is you have to
not
have
saline,
somebody.
is it?
Didn't come out of the ice chest, did it? Is if you have to have someone that educates the patients outside in the line. You have to have someone when you're handing out the folders that is knowledgeable enough to explain to patients what the impact study is and why you'd like them to participate.
Okay.
And one of just a very common statement that we'll make is this helps us do a mini needs assessment. It helps us figure out what your community needs
Yeah.
in terms of dental care.
Potentially bring help to your community
So that
through
we,
this information.
that's exactly right. So that we can figure out what you need.
Yeah.
So we can work with community leaders, with your county commissioners, with your city commissioners. The dental leaders in your community can take this information and help develop programs that are going to be sustaining effects for providing dental care.
Wow.
So that's really that's our after mom
Yeah.
effect that we're trying to show.
Wow. Well, I
So-
think you've more than answered the questions I have, and I think that's a great start. And I certainly hope that's something that we implement with our event and in the future, because I think it's just a key piece to making the impact that I believe that everybody would like to make.
Well, it's so important that, we have our 2-day event and we all feel great about the care that we give, and you see the smiles that walk out the door,
Yeah.
but you don't want it to stop there. And data is power. If you have that data, and I'll give all the props in the world to Mr. Steve Kess, who's Vice President at Henry Schein Cares. He's the one that first motivated me to want to do the study. And
Wow.
so I really again, give all the credit to Steve for being the push behind gathering data. And if we could get other states to do this and find, are there regional differences? Are they the same? This is very, very interesting. And I digress a little bit. The numbers for the patients who had been to an emergency department, the numbers of patients who had been multiple times in the last 6 months were within 1 percentage point the same in Jacksonville and in Pensacola, two opposite ends of the panhandle of Florida. So we had roughly 27% of the patients who had been to an emergency department once in the last 6 months. We had about 14% who had been twice. We had about 8% who had been 3 times, and we had about 4% who had been 4 times or more. And it was within 1 percentage point, again, opposite ends of Florida.
Yeah, and that's just...
And different communities, a very urban community versus a very suburban community. So the fact that those numbers were almost the same, so now here we are in Fort Myers, in a totally different type of area of Florida, and so it'll be interesting to see, are those the same? You know, if it is, what does that tell you about the population that needs care at a Mission of Mercy? What does that tell you about the collaborations, the interprofessional collaborations that we as dentists need to work on to truly solve the problem of access to care? So when we ask these patients all kind of information about why did you come here, what's the main reason, what are the other reasons, where do you go for dental care, when you find that information out, then you can use that to be able to develop programs that are really going to help the individuals that you want to serve after you pack up and the ADCF ban pulls out and we all go back to our lives. This is going to help people that are still in that community.
Perfect. Thank you very much.
All right.